Okay, so today we're going to talk about the cranial cavity. That's our assignment number 3, to talk about the cranial cavity. So cranial cavity, we can see here the skull is open, that in which on the left side you can see here the calvaria inner portion, and to the right side you can see here the inferior part of the cranial cavity. So we can study in this way that this is the roof and this is the floor. So let's start from here. The cranial cavity roof. In the cranial cavity roof, what we can see here, first of all, that is the frontal bone, and we got here the two parietal bones, and here we got the occipital bone. So between the frontal and the parietal, we got here the frontal suture. We got between the two parietal, sagittal. Between the parietal and occipital, lambdoid. Their intersection here respectively. Between the frontal and the sagittal, we got bregma, and sagittal and lambdoid, we got the lambda. So somehow we can see here in the frontal bone anteriorly, we got here the frontal crust, and we can see here the groove for the superior sagittal sinus. We can see here the fovea, granules, and we can also see the impression of the middle meningeal artery. Now let's talk about the cranial cavity floor. So the cranial cavity floor could be divided into the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. So we will talk about each of these fossa one by one. So first of all, let's talk about the anterior cranial fossa. Anterior cranial fossa, what things we can see in this fossa? First of all, here we can see here, this is a frontal bone, this is the ethmoidal, and this is a part of the sphenoidal. So in the frontal bone, we can see here the frontal crust. We can see on the ethmoidal bone here the foramen cecum, and this elevation we call the crista galli, and the both sides of the crista galli, small foramina, what we call that Cribri platform foramina. And here we can see the frontal bone is making the roof of the orbit. Here we go to the body of the sphenoid, and here we go to the lesser wing of the sphenoid, and this part here we are having the anterior clinoid processes of the sphenoid bone. Now we're going to talk about the middle cranial fossa. In the middle cranial fossa, we can see here the sphenoidal bone. We can see the part of the parietal and the temporal bone. So let's see there. We got here first of all anteriorly chiasmatic sulcus, and here we are having the tuberculum celli, and here this depression we call that hypophyseal fossa, where the pituitary gland is going to stay. And posteriorly, here we are having the dorsum celli and the posterior glenoid processes. This place here we are having the optic canal, and we got here the foramen rotundum. We got here the superior orbital fissure. We got the foramen oval, foramen spinosum, foramen lacinum, and the carotid canal. What else we can see here? We can see the trigeminal impression here, groove and hiatus for the greater and the lesser petrosal nerve. Here this spot we can see the tegmentum pani and arcuate eminence. Posterior cranial fossa. In the posterior cranial fossa, we can see here a small part of the sphenoidal bone. We got here the occipital bone. We are having the temporal and the parietal a little part. We can see this sliding part here, we call that sylvis. Here we are having the both side, the jugular tubercle. We go to the internal acutis meatus here. we got the jugular foramen, we got the hypoglossal canal, groove for the inferior petrosal sinus here. We are having the superior border at this place, superior border of the petrous part of the temporal bone, and groove for the sigmoidal sinus, as we can see, is following the S shape. In the middle, first of all, we can see here the foramen magnum, very big impression here. So posteriorly we can see here the internal occipital crust. We got here the internal occipital protuberance, and the both sides we are having groove for the transverse sinuses. In the summary, we can see the foramina and what structures are passing through. In the anterior cranial fossa, foramen cecum, a measuring vein to nasal cavity, olfactory foramen in Cribri plate from foramina, olfactory nerve. In the middle cranial fossa, we got the optic canal, supraorbital fissure, foramen rotundum, foramen ovale, spinosum, and the hiatus for the greater and the lesser petrosal nerve. In the posterior cranial fossa, we need to remember the foramen magnum, internal acutus meatus, jugular foramen, hypoglossal canal, and condyle canal and respective structure passing through there. Thank you.